122 died in the United States. I think the newest number was 120,000 people died of pure COVID without any sort of comorbidities. It was a bad flu. You basically had a bad flu made worse by the way they responded to it. And recently out of Europe, I have the article, I had downloaded it. The article was taking a look at, I know many of you had to get vaccinated for schools and your jobs and such. The newest number was based on that there's one death for every 800 shots that were given. There were over billions and billions of shots given, so the newest number said that causally they estimate that 17 million people died directly from the vaccine itself worldwide. That's kind of a high number, it's something to consider. But again, not in the news, you can find it, it is there, and these are prominent medical doctors, PhD researchers that are discussing all that. You've read all the other stuff of DNA in the vaccines and all the other lipid nanoparticles. But again, this keep your GI system healthy during the winter months. Take a probiotic. They're very inexpensive. Take a probiotic, eat well. Take some vitamin D3 and stay healthy. Stay out of the doctor's office. So anyhow, we talked about these layers. Let's talk about the third layer, and then I'll put up a couple pictures. The third layer is something that's referred to as the muscularis. Not the muscularis mucosae. That was part of the mucosal layer over here. This is just the muscularis. Now the muscularis actually, it's kind of interesting. It's technically two sheets or two layers of smooth muscle. So you think of it as two sheets or two layers of a smooth muscle. You remember back in chapter 10 of Anatomy 1, there was different types of muscle. There was skeletal muscle, cardiac muscle, and smooth muscle. Smooth muscle was non-striated and involuntary. We don't control it. We don't control most of our digestive process. We control a little bit of the swallowing mechanism. We don't, once it gets into the esophagus, we're not involved. The stomach, small and large intestine for the most part. At the end of the large intestine, a little bit when we're dealing with defecation. But it's smooth muscle, it's involuntary. But there's two sheets. The inner sheet, or what you would think of as the deep sheet of the two of them, this one has a circular pattern. So it wraps around the lumen. I'll show you a picture. And then the outer sheet of the two sheets, the more superficial layer of these two, this one runs in a longitudinal pattern. Looks like a pastry bag, basically. Have you ever seen them use a pastry bag to decorate a cake or make some fancy potatoes or something? You got to put your hand around it and you kind of slide it along to move whatever's inside the pastry bag out. That's what this does. This is actually the layer that's involved with peristalsis. The peristaltic action is because of this. So it works like a pastry bag, or the ladies would understand, the men have no idea what I'm talking about. It works like a toothpaste tube is supposed to work like. You start at one end and you squeeze it out, which the ladies do. The guys just kind of squeeze it and they put it on there, and that's not the way it's supposed to work. But that's the muscularis layer. And then finally, the most superficial layer, the one that's on the outside, the one that you would see if you were doing a dissection or looking at a surgery on the outside of the organ, is the serosa. The serosa is a serous membrane. Serous membranes are the opposite of a mucous membrane. A mucous membrane lines structures that do open to the exterior. A serous membrane lines structures that are not open to the exterior. They make a serous fluid. They make an oily sort of fluid. So it's a serous membrane that we have here, and it's technically made up of some areolar connective tissue, a little bit of that loose connective tissue, plus some mesothelium, simple squamous epithelium on the outside. And this is what covers the organs on the outside. We refer to it as a serosa. So let me see if I can get a picture up here so we can take a look at this. This thing keeps locking me out all the time. If I had a computer system at home like these at Bergen, it would end up in the road in front of my house. Just go right out the window. Let's see exactly where I want to be. Keeps taking me to the very, very end. I don't know why. Okay, let's see now. There we go. Now you can fall asleep or text your friend who told you to take my class and say, this guy's boring. Don't you tell me to much, he doesn't shut up. So here's just an overview of the digestive system. We've talked about the oral cavity or the mouth area. We're all familiar with it. We will discuss it a little bit more, each of these in depth. And we have our accessory structures. Human beings have 3 pairs of salivary glands. We have parotid glands, submandibular glands, and sublingual glands. We will discuss these. We have the tongue and the teeth in the oral cavity, all our accessory structures. The food from the oral cavity would then move into the pharynx. Now, the pharynx does have different parts. It has a nasopharynx. That's in breathing. That's for breathing. Although once in a while when you were a kid having lunch, your brother made you laugh, or you made him laugh, and he shot milk out his nose. That's not the way it's supposed to go. But we have an nasopharynx, oropharynx, laryngopharynx. And then we go into the esophagus, the tube that carries the food from the throat area down into the stomach. We can see a little bit of the stomach and a little bit of the outline of the stomach. The stomach then leads into the small intestine, which is all of this in here. There are different parts. We will learn about them. The duodenum or the duodenum, the duodenum, the jejunum, the ileum. There are 3 different areas of the large and small intestine. And then the large intestine is basically 3 sort of straight areas running along the perimeter with 90-degree curves in them. So it comes up on the right side, crosses the body here, travels down the other side, makes its way down to the rectum and anal area. And that would be our GI tract. And then we also have down in the abdominal pelvic cavity, the liver, this big gigantic thing, an accessory structure. The pancreas we don't really see here. They're trying to have some dotted lines that indicate, it actually sits posterior to the stomach. You have to physically lift the stomach to see underneath it, to see the pancreas. And then we have the little tiny gallbladder. It's about a 2 to 3 inch pear-shaped sac that sits underneath the liver. So those are the different parts that we have associated with the GI tract and the accessory structures. And a cadaver dissection looking in the abdominal pelvic cavity would look a little bit like this. You can see the diaphragm coming across. We have that broad dome-shaped flat muscle right underneath the rib cage involved with breathing. Right, diaphragm drops down. We inhale, diaphragm comes up when we exhale. We do see the liver here. This is the large liver. The stomach is kind of scrunched in this area over here. This is the stomach that we have here. These are mainly the small intestines. They're showing us different parts of the ileum and the jejunal area. They're parts of the small intestine. And then you can see the large intestine. It's much wider over here, the large intestine over here coming across this way. So for those of you maybe that are headed on to a professional medical school, osteopathic, dental, chiropractic, podiatric, you want to go into physical therapy or occupational therapy, you'll be doing some cadaver dissections. It'll look a little bit like this. And then these are the different layers. If we think of the digestive system, the GI tract, as sort of like a garden hose, and we cut it in a cross section, you have the hollow core where the food is traveling. That's the lumen. It's a common term. We use the term lumen when we talk about blood vessels have a lumen. The respiratory system has a lumen. It's just the hollow core area. And then around it, we can see the different layers. So here's our mucosal layer. The mucosal layer is made up of a lining epithelium. So we can see that here. This is a simple epithelium in this picture, but it can be a stratified epithelium. Then the pinkish area, that is the lamina propria. That has connective tissue there. Epithelial tissue is avascular, so it doesn't have a blood supply. It's got to get its blood from somewhere. It gets it from the blood vessels in the lamina propria. And then we have a very thin layer of something called the muscularis mucosae. You can also see in here some of the green structures that we have. That's what we refer to as the MALT, the mucus-associated lymphatic tissue that we have there. And that's spread out along the entire GI tract. Then we come out this sort of whitish gray region here. That's going to be your submucosa. It's a bit thicker. It's about the same thickness as the entire mucosa. So it's a thick layer of this connective tissue, very, very vascular. We have to absorb our nutrients somewhere, so they end up in the bloodstream there. Then we come out a little further. We have our muscularis layer, which you can see here, which is technically 2 sheets or 2 layers that we have. The inner layer, or the deeper one, this one here is going to wrap around this way. It goes circularly around the lumen, whereas the outer or the superficial one is running lengthwise. And with the 2 of them working together, that's what creates peristalsis, or movement taking place. And then finally on the outside would be the serosa. It's made up of this areolar connective tissue, which was a loose connective tissue, and some mesothelium. Now, thankfully, I do talk a lot, as you can tell already, and I do have you write a lot. I don't test on all of this stuff here. As you're preparing for testing, that's a way off. I'm just saying, I did include a review sheet for the first day. Stick with the review sheet. I like to give the entire picture. I like you to have the whole picture of things, but you know, I'm not going to test you on all of that. If it's not on the review sheet, don't worry about it. I mean, sort of like, I'm going to venture a guess in here that most of you own a smartphone, which some of you are probably texting your friends on right now that this guy's an idiot, but anyhow, and you have it, and you know how to make a call, and you know how to send a text or a picture of yourself with this type of thing, and all of that, but most of you probably have never ventured into the settings, real deep into your settings, and changed a lot of them. I'm taking a guess. They're there. Somebody could teach you about all those settings, but so long as you know the basic stuff, then you got it. I'll give you the whole picture, but I want you to leave with some knowledge that you can take with you. So if you're happening, you know, you're saying, gee, do I have to know all of this, that it's mesothelium? No, there's no question about mesothelium as part of the serosa on any test that I have. Just wanted to present that picture to you. I want to continue talking about the serosa, but let me show you on this picture first. The serosa is on the outside, it covers it, but the serosa is kind of interesting. The serosa actually physically extends beyond the organ itself. You can see here, this is part of the small intestine that we're looking at, but the serosa here is actually going beyond the organ. It doesn't just surround the organ, it goes beyond the organ, and it forms something that we call the peritoneum. So that's what I want to talk a little bit about now, is this extension of the serosa, or the peritoneum. Our digestive organs are kind of linked together. And we have this structure that's called the peritoneum, and I will show you some pictures of this also. The peritoneum is actually an extension of the serosa, where it goes beyond the physical organ. So it is this extension of the serosa. And what it's going to do, it's going to bind certain organs together. And we're going to give you some examples. One type of extension that we have, part of this peritoneum, is a structure called the falciform ligament. And I'll show you a picture of it also. The falciform ligament is part of the serosa. It's an extension, it's the peritoneum. And what this actually does, the falciform ligament, is it attaches, or if you want to say anchors, whatever word you want to use, but it attaches the liver, which is the largest organ in the body, to the diaphragm. So the falciform ligament is because the liver, we'll see when we do study it, it's basically covered with a peritoneum, but where it extends beyond it, it goes up and attaches to your diaphragm. Well, the diaphragm sits right at the bottom of your rib cage. It's involved with breathing, and the liver, which takes up almost the entire right upper quadrant, is attached to the diaphragm. You know, it's 3.5 pounds in size. If you didn't have an attachment when you would stand up in the morning and get out of bed, your liver would want to fall down because of gravity. It helps to keep the liver in place. Well, we have this falciform ligament. Well, we also have another structure that's referred to as the lesser omentum. The lesser omentum. The lesser omentum is, again, it's this peritoneum. It's an extension of the serosa. What this is going to do, this is going to attach the stomach and a small little part of the small intestine, something called the duodenum or the duodenum. We'll talk about it, but it takes the stomach and this duodenum, and there's different ways of pronouncing things, depends where you are in the country. Duodenum, 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 as long as you know it's part of the small intestine when we do study it, that's all that matters. You'll find, I had a friend of mine, he passed away, he was an older gentleman, he was an endodontist years ago, Dr. George Kozam. He was the head of anatomy and physiology at UMD and J down in Newark, and I met him when I had to have a root canal done when I was in grad school. But you know, and once he found out I was in grad school, then he was always asking me questions. And you know, we were talking one day about aortic aneurysms and such. And he mentioned something to me, and he goes, the location, where would you be locating and checking for something? And he used the word, he used this word umbilicus. I'm trying to think, he was educated down in Texas. Umbilicus, what the heck? The umbilicus. I'm looking, you know, looked at it and said, they go, you mean the umbilicus, belly button area there? That's what I told you, the umbilicus. There's different ways of pronouncing it. On the East Coast, what I have with my hearing, we call tinnitus. It's tinnitus. If you go out to California and stuff, they'll call it tinnitus. So this thing here, duodenum, 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 don't worry, as long as you know that that one is part of the small intestine. But what this does, it attaches these to the liver. So the liver is held in place by the falciform ligament, but the stomach and part of the small intestine is attached to the liver. It's not going to shift too much. We have a third structure. This one, some of you may be familiar with. It's something called the mesentery. It's the mesentery, and what the mesentery does is it comes off of the outside, as you can see in the picture at the top right there. It comes off the surface of the small intestine, and what it's going to do, it attaches the entire small intestine to the posterior body wall. Some of you may be familiar with it. I don't know, because the professors vary around here, if in anatomy when you did a rat dissection. I know that in my class we did a rat dissection. Some of the professors don't do it. But if you did the rat dissection, you may remember that when you opened up the abdominal pelvic area and you see the small intestine, as you pull the small intestine lightly out, it looks like a light film on it. It's between different parts of it. It's attaching all of the intestines to themselves and then to the back body wall. The intestines are not, I mean, I use the term garden hose a lot. It's not like a garden hose that's just loose. It would be as if you had a garden hose and you had saran wrap on the outside of it, kind of attaching everything to each other. So we have something called the mesentery, and we have a similar structure associated with the large intestine called the mesocolon. And the mesocolon is exactly the same. What it's going to do here is it attaches the large intestine to the posterior body wall. And again, I apologize for my handwriting. It's reaching that degenerative point. I apologize. So it attaches the large intestine to the posterior body wall. And then there's one last structure that we have that's part of this peritoneum. It's something that's referred to as the greater omentum. It's a little bit different, the greater omentum. We have a lesser omentum over here attaching the stomach and part of the small intestine to the inferior surface of our liver. The greater omentum is kind of interesting. The greater omentum actually doesn't attach or hold things somewhere. It drapes off of the transverse colon. Now I'm going to show you a picture. It drapes off the transverse colon, part of the large intestine, and it lies anterior to the abdominal organs. So those organs that are down in the abdominal pelvic cavity, this lies in front of it. Let me try to explain it a little bit. I think many of you are probably familiar with a catcher in softball or a catcher, baseball catcher. They wear a chest protector. You gotta think on a line like that, except it's not in the chest area, it's hanging in front of the abdominal organs. Our anterior abdominal wall is not that thick. Some of you probably have hoodies that have a heavier wall. I mean, it doesn't take much to take a knife and cut through this stuff. Unless a person's really, really heavy, I mean, you can go through it very, very easy. There's not much there. We need something to protect the organs. So in front of the organs, we have this structure called the greater omentum. The greater omentum has a little cute name. Remember the cute little name for the mitochondria? The powerhouse of the cell, we would refer to it. This one has a cute little name. This is referred to as the fatty apron. It has quite a bit of adipose tissue in it, and much like an apron that a chef would wear, which they, God bless you, hey, you want to wipe your hands, you lift the bottom of the apron up and you wipe your hands on it. It's tied around the waist. This is across an area, but loose at the bottom, and it provides a certain amount of protection. Now, it would vary. If you're going on to, let's say, PT school, get your doctorate of physical therapy, you're doing dissection work, if you have a person, the little skinny old lady is your cadaver, this greater omentum won't have much to it. If it's a rather rotund individual, number one is you'd cut through the anterior abdominal wall, you'd see a lot of yellow chicken fat in that subcutaneous layer. It looks like that. But then you get to the greater omentum, and it might be like a catcher's chest protector. You'd have something very heavy, you loosen it at the bottom, and you can lift it up. And let me pop up a couple of pictures here. Take a look at some of these things. So if you were to just open up the anterior abdominal wall, it might look a little bit like this. You would see the liver, not a problem, can't miss the liver. And here's your falciform ligament running in between, and that's going to attach up to the diaphragm, so the liver's held in place. So we have the falciform ligament over here. You can see the greater omentum hanging down in front. You don't really see much. I mean, here's the transverse colon coming across, but I don't see the ascending and descending colons. I don't see the small intestines really at all in the picture. In order to see those, you would have to do this. You would have to lift it up. It's loose at the bottom. This thing is loose down the bottom. You lift it up, and what they've done here is they've moved the intestines off to the side. This is your small intestine, and you'll note here that you have the mesentery, which attaches all the intestines, and they anchor to the posterior body wall, so they're kind of held in place. It's not labeled here, unfortunately, but running along the edge of the large intestine would be your mesocolon in here. You can't take this descending colon and move it over here to the other side. It's not going to move. It's got tissue holding it in place. So we have the mesocolon over here. And then, let me just go back a second. If we do this, they lifted the liver. They took the liver here, they've lifted the liver, they've resected off the greater omentum, but they're showing us here the lesser omentum, which is attaching some of the stomach, this lesser curvature of the stomach, and a little bit of the duodenum over here to the inferior surface of the liver. They're all kind of just connected together. It's not that they're just thrown in the body, we just toss them in there. They're all connected a little bit by these structures called the peritoneum. If an individual were, for example, to have a ruptured appendix and the infected material gets out, it gets into this peritoneal area, so you have something peritonitis. When you hear the term peritonitis, it's spreading in between all of these structures and the organs that we have here. So a little bit more with the boring preliminary stuff. So that's the boring preliminary stuff. I just want to introduce a little bit of the oral cavity area. We'll call it a day. I know that you're already fed up with me. I use, I think, what do they say, women use 50,000 words a day, or 40,000, men like 20, 25,000. I use all of mine at school, so I don't talk to anybody once I get home, which is a benefit. I've been married for 43 years, I don't talk much, so it helps my wife. She wouldn't want to listen anyhow. So let's talk a little bit here about the oral cavity, which we're all sort of familiar with, the mouth area. So the first part of our digestive system, taking a look at the GI tract, would be the oral cavity area. That's a question.
Is the appendix inside of the ascending colon, or is it like?
Oh, it's at the bottom of it's asking about the appendix, where the location. The appendix itself, the colon itself, the large intestine has different parts. The first part of the large intestine, down the bottom, actually, here's something called the cecum. C-E-C-U-M, and it just extends off of that cecum. It's part of the large intestine. It's actually about the size of your own pinky.
Okay, so it's only that little piece. I thought it was
Yeah, no, it's just this little thing that comes down. It's a little blind end set. They used to refer to it, I mean, when I was in school, they used to call it a vestigial structure, left over, but evolutionarily, it has no function at all. They found out it's very, very important. When we have GI disturbances, large intestinal disturbances, I mean, I think everybody here at one time has had a bout of some diarrhea. Well, anyhow, as your body's trying to clean it out, what will happen is in our large intestine, we actually have about 4 to 5 pounds of bacteria that live there. That's supposed to be there. It's healthy for us. It's part of the microbiome that we have there. What will happen is some of the bacteria will migrate down into that area and kind of hide itself down there. And once the immune system takes care of whatever's causing the irritation and the diarrhea that you have, those bacteria will move out again. And for those of you that have taken microbiology, some of you think have taken it, when you plate something, it doesn't take long for it to grow. I mean, so before you know it, you've got 4 or 5 pounds of bacteria again. So it does have an important structure. There's also quite a bit of lymphatic tissue down in this area also. So it's not this useless, nothing really useless that we have. Oral cavity, mouth area. Let's just talk about the borders. What actually would be the borders or the boundaries that we have that form the oral cavity? And let me put a picture up above me over here. Just for a second, here would be a picture of they did a dissection and they opened it up, and you can see here the diaphragm coming across, parts of the liver, the stomach. This is the greater omentum. This person doesn't have a lot of fat in it. But again, it just kind of drapes down. It's loose at the bottom. It's loose down here, but it's connected across this area here. So let's go to the oral cavity. Borders and boundaries. If we talk about the borders or boundaries, the hard and the soft palates They actually form the roof. So the hard and soft palates form the roof of our oral cavity. If you're not allergic to it, and you were a kid and you ate a peanut butter sandwich and it got stuck to the roof of your mouth, you know where your hard palate is located up there. They form the roof. The cheeks will form the sides of the oral cavity, and the tongue forms the floor. So we have the roof, the sides, and the floor. The anterior boundary, or the anterior border, when we talk about, where does the mouth actually start technically? It's something that's referred to as the oral vestibule. It's called the oral vestibule. What the oral vestibule is the actual space between the inside of our lip and the gum. So the space between the lip and the gum, that would be your oral vestibule area. That's our anterior boundary. Well, then we have to have a posterior border or posterior boundary. What is that? The posterior border or the posterior boundary is an interesting area. It's actually referred to as the fauces. That's the name of it. We call it the fauces. It's a narrowed area. It's a narrowing that we have toward the back. There's a landmark that tells us that we're at the fauces. The landmark that says that we're at the fauces is a structure that you're all familiar with. That landmark is something that's referred to as the uvula. It's called the uvula. It's that little thing that hangs down, looks like a punching bag in the back of your mouth area. Or if you've watched Pinocchio when you were a kid and he got swallowed, Papa Geppetto, by Monstro the whale, and he's inside the whale, you can see the uvula hanging down. That little thing that hangs down is called the uvula. That tells you you're at the fauces. That's the narrowed area that goes across the back. So if we're looking at the picture on the board, if we look at this, the space between the lip and the gum is something that we refer to as the oral vestibule area that we have. So anything that's up in this area would be the vestibule region that we would have. The cheeks are forming the sides. The hard and soft palate form the roof. Tongue forms the floor. They have it lifted for a different reason that we'll discuss when we get together the next time, but we have this. And then in the back, you can see the uvula hanging down here, and then these arrows going to the left or the right. That's the fauces. That's the opening. Once you pass that uvula, you've now entered into, let me echo through this, we're now entering into the throat area at that point. So we have the different borders and boundaries. The entire oral cavity itself is lined with a mucous membrane. Mucous membranes line structures that open to the exterior. And then the last thing that I want to mention are just these interesting arches that we have in the oral cavity. Associated with the oral cavity are two pairs of arches. And while I'm finishing this up, I'll just make mention. I know someone probably in here has the attendance list. If it's near you, start it going back the other way, because some people came in later and have an attendance list. You can check yourself in. It's got to be somewhere in the room. It's not passing it along, send it one way or the other way, and make sure you check yourself in. There's 2 pages. One page is for Tuesday's lab class. The other's for Wednesday. Take a look at both of them. Make sure you're on there. Check yourself in. If you're not, then you can handwrite it. It's a preliminary list. So there's these 2 pair of arches that we have. We have 2 arches that are referred to as palatoglossal arches. There's 2 palatoglossal arches that we have. Palato dealing with the palate, the roof of the mouth, and glossal deals with your tongue. So they come down toward closer to the tongue. And then we have 2 other arches. I'll point them out on the picture above my bald head. We have 2 palatopharyngeal arches running from the roof of the mouth down toward the throat area. In and of themselves, they're just structural arches. Arches are supportive. And, we've seen pictures from all along ruins along the Mediterranean, the Middle East, the Far East, and archways. They're supportive. They give a lot of support. Well, we have arches that support support the back of the throat area. They sit back in these areas. Let me turn the lights off for just a second. This is the last thing we're talking about. So you have an arch that runs from the roof coming down here, and on this side, that would be your palatoglossal arch. Then further back, going toward the throat, running from the palate down toward the pharynx area, is an arch on each side. To basically support the opening between the mouth area and our throat area. Now, the only reason I mention these is because something interesting is located here. In between these two arches, and I swear this is the last thing I'll mention, we do find here our palatine tonsils. The palatine tonsil is embedded between the arches. A tonsil is a lymphatic structure. We need to protect the gateway to the respiratory and the digestive system, and so we have the tonsil in this area, and you can see it in the picture here. Palatoglossal arch, the front one, palatopharyngeal in the back, and then embedded in between those would be your palatine tonsils. They used to remove them quite commonly when I was a little boy. I still have mine, but many of my friends had their tonsils removed. You probably haven't. Go home, take your light on your phone, turn it on, take a look in there. Look where the uvula is hanging down, look to the left and right side. You'll see something that looks like a pink-colored prune, wrinkly and stuff. Those are your tonsils that are back there. They're lymphatic structures protecting protecting the respiratory and the digestive system. So I appreciate you ladies and gents putting up for the long, long lecture. You thought I was gonna come in, say hello, go over the syllabus, and